Yo, welcome. How you guys doing? My name is Dr. Isang, cardiologist. If you can hear me, let me know in the messages and then I will start. Just want to make sure that the audio is okay and everybody can hear me appropriately before I start the topic, the conversation. All right. Heart disease is one of the leading causes of death in the United States of America. That means it's more than cancer, it's more than lung disease, more than diabetes, more than kidney failure. And why this is important is that a lot of times if people understand what the risk factors for heart disease are, you can potentially prevent it from happening. With heart disease, a lot of people are passing away due to myocardial infarction or heart attacks. And some of them have symptoms of a heart attack that they tell me, but unfortunately didn't think too much of it, went to sleep, and then either didn't wake up or woke up and their life was drastically different. So, one of the questions I want to ask people is how can you tell if you're having a heart attack versus if it's something else? If it's palpitations, if it's anxiety. Number one, if you're having chest pain that is new, meaning that you don't usually have chest pain or you don't have any reasons to be having chest pain, go and get seen as soon as possible. Any new type of pain and discomfort can be potentially something coming from your heart that needs serious attention sooner than later. Sooner because if it is a heart attack, if it is blockage in the heart arteries and it gets opened up, you can potentially restore your heart function to how it was prior to having any blockage. A lot of times people are waiting to get seen, waiting to be to see if their pain will get better, and then they go to the hospital. But by the time they go to the hospital, we can try to put a stent in, but it may not change the outcomes. The damage may have been too far done. You may lead to complications of a heart attack, such as a hole in the heart. We call it as a ventricular rupture. You can have serious issues with heart valves, mitral regurgitation. So it's important that if you're having any type of heart disease, go and get checked. Go and get checked as soon as possible. So, what are typical symptoms of someone who's having a cardiac event such as a heart attack? First one is going to be chest pain, pain in dislocation. We get nervous if that pain is here and it radiates to the shoulder. We get nervous if that pain gets worse with exertion or stress. We get worried if that pain is better with rest or medication called nitroglycerin that helps to dilate arteries. If you're having any of those, go and get as soon as possible, whether that's with your primary medical provider, urgent care, ER, go get seen. What else can people complain of? They can also complain of jaw pain. They complain of shoulder pain. We have to also realize that in some cases, women, diabetics, and people with kidney disease can have different presentations that if they're having these presentations, we should not ignore it. It can be abdominal pain, elbow pain. If they're having that, and especially if it's new, they should be checked out to make sure it's not coming from their heart. So what else can people complain of other than chest pain? Jaw pain, once again, shoulder pain, elbow pain, shortness of breath. If the shortness of breath is new, it can be from decreased blockage in the heart arteries. It can be issues with the heart not squeezing appropriately, and the heart may not be squeezing appropriately because there's been damage to it. There's been a blockage. We can evaluate someone who's having a new issues with shortness of breath with an echocardiogram, which is an ultrasound of the heart. If we see that certain areas of the heart's not squeezing appropriately, we would proceed with further testing, such as a stress test or even a cardiac catheterization to look for blockage. So if you're having any type of new shortness of breath, new exercise intolerance, please go and get seen as soon as possible. Some people I've also seen that they have high blood pressure when they normally don't. I've had a couple of cases where someone completely normal, no medical history, now has high blood pressure, and we do appropriate testings, and we find out that they have had a heart attack or they have blockage that is leading to them having elevated blood pressure. So whether you're having chest pain, whether you're having shortness of breath, jaw pain, shoulder pain, go and get seen. Understand that if you wait too long, it can potentially lead to something bad happening. It can lead to that artery being difficult to open up. It can lead to complications of heart attacks. So if someone is having these symptoms, what do I want them to do? Go to the hospital. We check certain tests such as troponin levels, which is released from the heart under stress. We can check an EKG. If your symptoms have resolved and you don't have a lot of risk factors or intermediate risk factors, we can do a stress test. But if you meet all the criteria with the risk factors, blood tests, then we would proceed with a cardiac catheterization, invasive procedure to look for the potential blockage. After we open it up, certain medications you may need to be put on, especially if your ejection fraction or heart squeeze function has reduced, then we would need to treat that appropriately. ACE inhibitors, beta blockers, aspirin, cholesterol medication, and possibly something else if we have to put another stent in. If we have to put a stent in. Someone said, why does my heart beat fast? A lot of things can cause elevated heart rates. Can be a natural or normal phenomenon, can be due to stress itself, can be due to infection. Fast heart rate is a normal thing. There are some people who have irregular heart rates. We further investigate that with something like an EKG or a heart monitor that can go anywhere from 24 hours upwards to 30 days. You can actually have one implanted that can last upwards to 3 years. Internship report card help with cancer treatments. I'm a cardiologist, so I don't deal with a lot of the cancer medications. You would be looking for a hematologist, oncologist. All right, just to sum things up, if you're having pain here, pain that goes to the shoulder, pain that gets better with rest, or pain that gets better with medication called nitroglycerin, you may be having cardiac pain that is concerning for a potential heart attack. Go and get seen as soon as possible by your primary care, by your urgent care emergency department. We may do an echo, EKG, or even a stress test. If you have enough risk factors, we may do a cardiac catheterization to look for blockages. If we put a stent in, you may need to be put on aspirin and something else, whether it's Plavix or Prasugrel, or I can't think of the third one. Aspirin, Plavix, Prasugrel, Brilinta is the other one that I was thinking about. Something for cholesterol. If your heart is not pumping appropriately, we may need to be put on something like an ACE inhibitor or beta blocker. Most important thing is that if you're having any new symptoms, please go and get seen as soon as possible. My name is Dr. Etang. If you got any benefit, leave me a message, leave a comment in one of my videos. Thank you.